Hello, Dr. Hashmi here. I'm just a psychiatrist. How to bring work-life balance in your life. In this day and era, when employers gives you the most latest phone, a laptop, sometimes a car, but the technology, the blessings of technology is not for any other purpose except to trap you as a 24-hour employee. Remember this. Now, you may end in working for your employers for many unpaid hours. At what cost? Cost of your health, mental health in particular, cost of your family life, cost of your time you could have spent with your children. By the end of the day, the most important thing in life is to be with our loved ones. We do all these jobs for what? To have a good quality time with my children, not only the 6 weeks holiday or 4 weeks holidays in a year. And still during those holidays my phone is switched on and the mobile is switched on. If you were to do one thing to bring change in your life, to achieve work-life balance, only limit your working hours to working hours. If you are paid for 37.5 hours in a week and you are expected to finish your work at 5 o'clock, finish it at 5 o'clock. You're not employed, you're not hired, you're not paid after that time. The reason I'm saying that is if you don't do that, you will end in paying the price one way or the other. And employers might not see you as the employee of the year, might not invite you on a big, huge evening and award you with the certificate. Fair enough. But what is the most important thing you want to achieve? The most important thing is you being in good physical and mental health and social health, which we forget. How many people I know and how many people I work with who don't even have time to see their friends once in 6 months. Our friendships are now limited to people we know at workplaces. People we work with, they have become our friends because we don't have capacity to find people outside that workplace. Is it healthy? This is my question. Think about it. It's just food for your thoughts. Once you have finished your work your contractual hours, switch off your mobile, switch off your computer, which is blessed by the employers to give you an extra access. The moment you switch on the computer, even for any other reason, you will be bound, naturally bound, to look at your emails. You switch on your mobile, you will be naturally bound to respond to the messages. You won't be able to stop yourself. If your boss's message is there, you will have to look at it. So once you have left work, switched on the technology or the equipment the employers have given you, and leave it aside until you return to work the following day. That's the only one change if you bring in your life. You will reap the benefits. Work is not all life. There is more to life than work. Thank you. Now, this video is about good prescription and bad prescription. You don't know whether you are on a good prescription or a bad prescription, but what is prescription? Prescription is a set of medication or recommendation of medication prescribed by a registered medical professional to an individual or a patient to treat any specific condition. Now, a good prescription carries a hallmark of communication between doctors. So if I look at the prescription and I cannot work out the thinking process gone behind that prescription, that is a bad prescription to start with. If I look at the prescription and I know straight away what the prescriber was thinking the time he or she wrote that prescription, that's a good prescription. Number two, a good prescription generally carries one drug for one illness. For example, if somebody satisfies the criteria to be treated with medication for depressive disorder, plenty of depressive disorder medication is on the market, one good quality antidepressant should treat depression. If somebody is on 2 antidepressants, 3 antidepressants, which I have come across prescriptions like this, or additional drugs, and one doesn't know why the medication is taking, that's a bad prescription. Then one needs to know why the person is prescribed the medication. When I sometimes ask patients, you are on all this medication, why are you taking all these medication? A lot of times they have no idea why they are taking this medication. That means that's a bad prescription. They don't know that why they are taking that medication. It is the responsibility of a prescriber to explain to the patient why they are on any specific medication. Then the last thing is, a good prescription will not have extras to it. A bad prescription will be full of extras, like the medication which might not be directly linked with the treatment of disorder, but just for the sake of completion added to the prescription. Secondly, every drug is recommended in a specific dose for treatment. If you prescribe medication in a subtherapeutic dose, that means less than what is required to treat a disorder, and then you add another medication to it, again in a dose less than what is necessary to treat a disorder, that's a bad prescription. So there's a good prescription, there's a bad prescription. Always ask your doctor why
you are prescribed any specific medication, what are the side effects of it, and take your full list of prescription to the doctor. Ask them, is there any interaction between this medication? Are there any side effects which actually making the prescription not work in a cohesive way? If the drugs prescribed on a medication, on a prescription, if they are working cohesively, they are going to get you better. If the drugs are not working cohesively, you can take 10 tablets in a day, you're not going to get better.